And so people want to know, really, what's the problem with the nerve? Well, there's multiple types of symptom or diagnoses that can cause a nerve to not function correctly. And what I mean by that is either the nerve is not sending the signal on, or the nerve will start firing abnormally and sending signals to the brain, as in numbness and tingling or even pain, when there's really not a reason to have pain. A lot of times it's compression, meaning pressure on the nerve, like within scar tissue, or a pinched nerve in their back, or a carpal tunnel where the nerve gets pinched as it travels through the wrist to get to the hand. And usually it's a compressive etiology, meaning a compressive reason, something that's pressing on that nerve that's causing it to misfire. The other types of neuropathies, and this is more with people that have peripheral neuropathy, meaning usually in the feet, is that those nerves are diseased. Their anatomy has been changed either from poor circulation, poor glucose control, as in diabetics, or again, we don't have a good reason for patients. Maybe it's something on the DNA. There's still a lot that we don't know about this. But neither here nor there, it's that nerve is not firing correctly. It is sending abnormal signals to the brain. And the reason the feet are much more common than even the hands with peripheral neuropathy is because by the time the blood flow gets down to our feet, the oxygenation of the arterial blood flow to those nerves is a lot less. And also the feet takes a lot of abuse as we're pounding on the pavement our whole life. And so most things usually happen distally, because by the time the arterial blood flow gets down to the oxygenated blood flow gets down to the feet, there's a lot less oxygen than, let's say, a foot away from the heart. And so you're more apt to have problems in the periphery than not. And those are usually people that have, it's a functional problem with that nerve, because somehow something has caused the nerve to not fire appropriately. And usually it's an environmental thing, as I stated. But the compressive issues, a lot of times with these posterior people that have had knees, or people that had a shoulder replacement but still having pain, well, we can't go in there and do another surgery to get rid of this nerve out of the scar, because that's just going to cause more scar tissue. So that's not really a great answer. And so again, for decades we had nothing for patients, but now we have a great deal of tricks up our sleeve to treat nerve pain with these folks that have nerve root or peripheral nerve pain.